Pterygium is growth of the outer coating of your eye, otherwise known as the conjunctiva, onto the transparent window to your eye, also known as the cornea. It is usually benign and is not cancer and is very slow growing. Most patients present with either irritation, redness to the eye, and occasional pain. In late stages of the disease, patients can have their vision affected as the growth starts to affect the central part of the cornea, affecting their visual axis or line of sight. Pterygium does not go away on its own, but we can treat it symptomatically with a combination of lubricant drops with or without steroid drops to address the inflammation. There's no treatment without surgery if you want to remove pterygium on its own, but like I said before, the drops can help you with your symptoms if you do not wish to proceed the surgical option. We only proceed to surgery if patients' symptoms are not adequately managed with either lubricant drops or steroid drops, or if the pterygium itself starts to affect the patient's vision. Pterygium surgery is a day case procedure, and most of the time is done under local anesthetic. The surgery itself can take about 30 minutes to an hour, depending on the complexity of the case. We remove the pterygium from your cornea and a large part of it from the conjunctiva. That will leave behind a gap in the mucous membrane, that is the conjunctiva, and we will cover that gap with an autograft, otherwise known as a conjunctival tissue, either from the same eye or from the other eye. This autograft will then be placed onto the gap in the tissue with glue, and sometimes will require absorbable sutures if the gap is too large, and these absorbable sutures will dissolve on its own. The recovery period usually takes about a week, and you may get some slight irritation or pain within the first week of the procedure, but we will try and minimize this with the use of a bandage contact lens on the eye and suitable or appropriate use of oral painkillers. Pterygium does not cause blindness, as surgery certainly helps with improving the patient's vision when it starts to affect the central visual axis or line of sight.